So here are 12 disturbing symptoms that may suggest that your kidneys are failing. Please don't wait for these things to happen before you get your kidneys checked, because I have seen it so many times that patients come in, they just came to check their, if not patients, people that met me through my videos of talking about kidney, they just decided, let me just go and check, and sent them, because I offered them free interpretation of kidney tests, which I don't do now because there are a lot, except you book an appointment. And then that's how they find out that their kidneys are deteriorating. So don't expect these symptoms before you check your kidneys. So these symptoms means, most of the time before you get these symptoms, it means that your kidney is like 70% gone, or 60% gone, or even 100% gone. So most of the times it means that your kidney has failed drastically before you experience these symptoms. So don't say, I'm not experiencing these symptoms, so why go check my kidneys? No, do check your kidneys. I'll still put a video on the description box on tests you should do, test that you should do for how to check your kidneys. I'll put the video link on the description box, so that you will know the test you can actually do, so that you can be able to check your kidneys. So now let's get to it. Okay, number one symptom that your kidneys are failing is unusually tiredness. You are fatigued, you're so tired. When your kidneys are failing, the way that the way your kidney functions has reduced. So remember, your kidney has the function of maintaining your blood sugar, blood pressure, removing toxins in the form of urea and creatinine. All those things you eat, it has a way of removing them. So because your kidney function is deteriorating, those toxins will still be in your system. So you find out that you'll be unduly tired. You will become very tired and then weak. So when these things are happening, please go and see the doctor. And please let it be known that, don't say because I've said one symptoms and these one symptoms that is happening to you, it means your kidneys are failing. No, these symptoms will culminate with a lot of symptoms that I'll be mentioning, and of course the final thing, which is your blood test that will now review. So don't say because I say swelling legs and your legs are swelling, it means that your kidneys are failing. No, swelling legs could mean a lot of things. So please, number one, which is weakness. Okay, I know you're very, very weak. Number two is your body is itching you, scratching you unduly. Remember, it is not when your body is itching you now. You said that, Nurse Merit said that when your body is scratching you, it means that your kidneys are failing. But cumulated with other symptoms, you will still just go and see the doctor. Okay, when your body is itching you, this means that some of these toxins, which is urea and creatinine, some of them have embedded on your skin because they are finding a way to go out, because your kidneys can no longer filter them. So this will cause your bodies to start itching you, and sometimes it makes your body dry. Another symptoms of chronic of that your kidneys are having issues is that you are having pain at your back. Having serious pain at your back may mean that your kidneys are failing. At where your kidneys are located, sometimes it may be a sharp pain, which may be a typical symptom of kidney stone or kidney infection. Don't ignore any pains that are related to your back where your kidneys are. Your kidneys is not in the stomach, it's at your back. Okay, your two sides, so it can be anywhere. So the next thing that another symptoms that may suggest that your kidneys are failing is what we call uremic breath or mouth odor. So you're not a person that has mouth odor and all of a sudden you notice that your mouth starts smelling. Now this is known as uremic breath. It means that the toxins has become so much, and when it becomes so much, it brings this mouth odor, odor breath. It's called uremic breath. So when you notice any of these, make sure that you see the doctor. The next thing is, of course, swollen stomach, generalized edema, swollen stomach, swollen legs, swollen eyelids, swollen hands or anywhere, especially when you press it, it pits inside. This is an underlying symptom that your kidneys are failing, because your kidney cannot remove the water in form of urine that so water is now accumulating. Remember, if your kidneys are failing already, we'll have videos on here. I'll put it, just go to the description, but you'll see a lot of videos that will help you. Videos of how to know your kidney, how to revive a failing kidney, what to do, foods to avoid when your kidneys are failing, diets for diabetes, for dialysis, people that are on dialysis. Remember, if you want to have a consultation with me, you want to have a consultation with a nephrologist, you're seeing some symptoms, you don't know what is going on, just the description box, you see a WhatsApp link, okay, or probably chat the number that will be on the screen to book a consultation with us. Then please, when you notice your body is swelling up, please go and see. It's an impending sign that your kidneys are failing. Now, the next thing is another typical symptoms that your kidneys are failing is when you are urinating. You are, going to toilet always, all of the time. You're urinating. Always you're urinating. Please, this may be an impending sign that your kidneys are failing, especially at the earlier stages, and especially at night. Now, there is also a stage where you will not urinate at all. So it can be when you're urinating very frequently, and then when you stop urinating, especially when you stop urinating, that's the oliguric stage. It means that your kidneys are shutting down fast. So you have to see a doctor. Remember, there are other things that can make you urinate. Other cause of frequent urination, I'll still drop the link of the video here in the description box. So the next food, or then sorry, I'm saying food because I'm making diabetic food and high blood pressure food video for people that registered for our class, so that's why I'm talking about food all the time. So the next symptoms that may suggest that your kidneys are failing is very important. Don't ignore this one. Foamy urine. When your urine foams, especially that kind of foam that when it foams, it doesn't disappear, your kidneys, these are symptoms of kidney failure. Or even after flushing the toilet, the foams are still there. It's like bob. It's not like bob. It's foams like beer. The way you pour beer. Please, this means that a lot of protein and albumin is being, secreted, passes through your kidneys and then to your urine, and this is not supposed to be so. For protein to be in your urine, it means that the kidneys are already having issues. Another typical thing is that if you go for test, let's say you just going for test and they say they see like 3 proteins in your urine, they see lots of protein in your urine, it means something is already happening in the kidneys. Please do not ignore this symptom. Another thing is if you're noticing blood in your urine, which is not supposed to be so. Now, these are the things that should not be seen in your urine: kidney, your blood, sugar, protein. They're not supposed to pass through your urine. So any reason where blood is your urine means that the kidneys pores are becoming to be open for urine and protein for blood and protein to be to pass through. So please, when you notice blood in your urine begins to bubble, foam so much that it doesn't even disappear after a minute or 30 seconds, rush to the hospital. Do not wait for these symptoms to happen first before you go to the hospital. I will still tell you the tests you will do also to help check your kidney function as quick as I can. Another symptom is unduly muscle cramps. Your muscle is cramping. This is because the electrolytes that are dysfunctional, sometimes they are being in your muscles and then they're cramping you. Example, calcium is now depleted, is now being because they are lost, probably excess of calcium. It will now find itself in your muscles and then your legs. It starts cramping. Okay. Of course, another one is reduced appetite, which this is a general symptom. Everybody can just decide and they are sick with, as simple as probably infection or malaria, but you will not eat. But I still have to mention it that coupled with all of these symptoms, your appetite is significantly low because of it happens because of buildup of toxins in your system. The ones that you've eaten, your body, the toxins are still in your body, so it will make your appetite low. Okay. Very important is blood pressure that cannot be controlled. If you notice that your blood pressure, no matter what they give you, it is not controlling, please, it may also be an impending sign that your kidneys are failing, because the kidneys are responsible also for helping control your blood pressure. So when your kidneys are failing and then you have high blood pressure as well, and your when your kidneys are failing, normally you will develop high blood pressure. So when you don't even know, you think you're just having high blood pressure, and when you notice your blood pressure are not being controlled despite your medications and your dieting. And remember, food is important. Join that class we are holding if you've not, and I'll still send you link of videos of how to naturally control your blood sugar level. So it may mean that something is going on with the kidneys, because your drugs coupled with everything, your blood pressure should be low, should be optimized. So if it is not working, means the kidneys is having issues and something has to be done. Another one is shortness of breath. You are tired, you just go from here to here, you're tired. This may be because there's a lot of fluid in your lungs, and it will make you weak as well, and a lot of buildup of toxins also in your body. It can make you very weak, as we stated earlier. Very important is mental fatigue or sharp of mental alertness. You used to be very smart before, or when they tell you something, before you remember, it's the person is just confused. This can be sometimes referred as uremic encephalopathy. The person, uremia, the toxins has built up so much that it went to the brain. The person is not okay. So these are typical symptoms. Please don't wait for these symptoms before you see the doctor or before you do your kidney function tests. I have made it a point of contact to do your kidney function test review free, but it's thousands are coming in, so I can't. I have to find a way to minimize it. I find a way to, reduce your, what am I saying? So I found a way to reduce the number of requests coming by asking them to book consultation. Because when you send interpret the results and I say it's not fine, it's not okay, the next thing is they will start asking me, practically consulting with me, and if I don't continue the chart, the person may feel offended. So but I'll still try my best to explain some if I can. Now so another symptom is loss of sleepness. You don't sleep very well, you just sleep off a little bit, you wake up because you're not mentally okay, because of the buildup of toxin in your brain and in your system. You will be restless. Okay. Then another one is chest pain. Of course, if fluid built up around your chest, you'll be having chest pain, and then shortness of breath and all of those things. Now the final thing that will finally diagnose that your kidneys are failing is blood tests. When your doctor does blood tests for you, which will be kidney function tests, estimated glomerular filtration rates, and protein clearance ratio, these are the things that will now determine if your kidneys are failing or not. So when you're noticing any of these things, go to the hospital. Please don't expect yourself to notice these symptoms before you go to your hospital. You should check your kidney function at least once or twice a day. All you need to do is just go to the lab and say you want to do kidney function tests. When you do it, of course, you can ask them to help you explain if it is okay, or you can take the results to a hospital. Okay, so let me know if you have more questions and put it in the comment section. If you're noticing your issues with your kidneys, please, any of these symptoms, don't wait and go to the hospital. I hope you must have liked this video, and I hope you must have followed us, and I hope you must have click on your notification button so that when I make videos, you will get them. Have a nice day.